Good afternoon. Our group decided to make this presentation on the male reproductive system. Now, to introduce the topic, the male reproductive system is a complex and vital component of the human body. It's responsible for the production, transport, and delivery of sperm, as well as the synthesis of male sex hormones. Its primary function is to facilitate sexual reproduction by ensuring the fusion of male and female gametes to create a new organism. This system comprises various organs and structures working together harmoniously to achieve this crucial biological function. At its core, the male reproductive system can be divided into two main functions. First is sperm production. Sperm, the male reproductive cells, are generated through a process called spermatogenesis. This continuous production ensures a constant supply of sperm throughout a man's life. And second is hormone regulation. The male reproductive system also plays a crucial role in the production and regulation of hormones, primarily testosterone. The male reproductive system produces this male sex hormone, which has far-reaching effects on various aspects of male physiology, including the development of secondary sexual characteristics like facial hair, muscle mass, and voice deepening. So, how does the male reproductive system work along with all the other systems of the body? The male reproductive system works in coordination with other bodily systems, such as the nervous system and endocrine system, to facilitate sexual function and reproduction. When sexually aroused, the brain sends signals that triggers a series of events leading to the release of sperm during ejaculation, during copulation. Sperm are transported from the testes through a network of ducts, including the epididymis, vas deferens, and ejaculatory ducts, before being mixed with seminal fluid produced by accessory sex glands, including the prostate and seminal vesicles. This mixture, known as semen, is then expelled from the body during ejaculation. So, in summary, the male reproductive system is a complex and highly organized system with the overarching goal of ensuring the survival of the species through sexual reproduction. This intricate system underscores the importance of maintaining its health and function for overall well-being and the potential for procreation.
So this is the overview of the anatomy of the male reproductive system. So first is the penis. The penis is an external reproductive organ of the male. It is made up of two parts, the shaft and the glans. The glans is the tip of the penis, while the shaft is its main part, and it contains the tube or urethra that drains the bladder. So the third one is the scrotum. The scrotum is a bag of skin that holds and helps to protect the testicles. The testicles make sperm, and to do this, the temperature of the testicles need to be cooler than the inside of the body. This is why the scrotum is located outside of the body. Next is the urethra. The urethra is a tube that allows urine to flow outside of the body. It is also the channel for semen to pass during ejaculation. The brain signals the bladder muscles to tighten. This squeezes urine out of the bladder. At the same time, the brain signals the sphincter muscles to relax to let urine exit the bladder through the urethra. The fourth one is the testis or the testicles. The testes are two small organs that are found inside the scrotum. These are responsible for making sperm and are also involved in producing a hormone called testosterone, which is an important hormone during male development and maturation for developing muscles, deepening voice, and growing body hair. The fifth one is the epididymis. It is a long tube that is located near each testicle. Its purpose is moving the sperm from the testicles. Next is the vas deferens. This is a tube in which the sperm is stored, and it carries the sperm out of the scrotal sac. The vas deferens is between the epididymis and the urethra and connects these together. Next one are the seminal vesicles. These are sac-like glands that lie behind the bladder and release a fluid that forms part of semen. Last but not the least is the prostate gland. It is about the size of a walnut and surrounds the neck of the bladder and urethra. It is partly muscular and partly glandular, with ducts opening into the prostatic portion of the urethra. The prostate gland secretes a slightly alkaline fluid that forms part of the seminal fluid, a fluid that carries sperm. So those are the major parts of the male anatomy: the penis, urethra, scrotum, testis or testicles, epididymis, vas deferens, seminal vesicles, and the prostate gland.
According to a study conducted by Louis Mar A. Guangquanco and Patrick C. Estacio, in the past decade, the Philippines has gained notoriety as the country with the fastest HIV epidemic in the Western Pacific region. From 2012 to 2023, there was a 411% increase in daily incidents. Most of these cases are from men having sex. As of January 2023, there were 110,736 HIV cases reported in the Philippines. Although this seems a bit low compared to the country's population, this number is projected to increase in number by 200% from 158,400 in 2022 to 364,000 in 2030. The Philippine HIV and AIDS Policy Act of 2018 expanded the access to HIV testing and treatment by allowing the screening of minors from ages 15 to 17 without parental consent. There has also been advancement about self-testing and community-based screening. The number of HIV screening and treatment facilities have also risen in number throughout the years, but it does not stop the fact that the HIV epidemic remains. The epidemic cannot be controlled fully because of continued stigma, social-cultural factors, political deterrence, and other factors. The HIV epidemic in the Philippines requires a multi-sectoral approach that calls for sustained political support and continuous community involvement.
Hello everyone. My groupmates discussed the overview of the male reproductive system and the recent studies concerning the latter. Now, let me discuss the homeostatic imbalance and the diseases concerning the male reproductive system. Let's begin with testicular cancer. Testicular cancer is not the most common of the male reproductive system diseases, yet it affects 1 for every 250 males. It is not the deadliest disease, but the chance of death for having testicular cancer is 1 out of 5,000. Testicular cancer, like other cancers, is formed when cells multiply faster than usual and eventually form a lump or a tumor. The right testicle is more affected compared to the left testicle because of cryptorchidism. Other causes of testicular cancer are family history, testicular trauma, and high maternal estrogen levels. Chemotherapy, radiotherapy, and surgery are the common ways to treat testicular cancer. Next is balanitis. Balanitis is an inflammation of the glands which is the head of the penis. Symptoms of balanitis can include penile pain, swelling and itching, a rash on the penis, and a strong smelling discharge from the penis. The most common cause of balanitis is poor hygiene in uncircumcised males. If the penis isn't properly cleaned underneath the foreskin, bacteria, sweat, dead skin cells, and debris can build up around the glands and lead to inflammation. Next is Peyronie's disease. Peyronie's disease is a penile condition that develops when scar tissues, called plaque, form inside the penis and cause erections to be curved and painful. Signs and symptoms of Peyronie's disease include scarce tissue that can be felt under the skin of the penis, a significant bend or curve of the penis, difficulty getting or keeping an erection, pain in the penis, and shortening of the penis. Let's proceed to priapism. Priapism is a persistent erection that lasts more than 4 hours and is not relieved by orgasm. Erections that occur with this condition can be painful and are not always related to sexual activity. Common causes includes medication, alcohol and drug abuse, especially cocaine and marijuana, spinal cord problem, and certain blood diseases. I mentioned persistent erection in the earlier slide, so let's now discuss erectile dysfunction. Erectile dysfunctions happen when you can't get or maintain an erection. It isn't always a cause for medical concern, as stress and anxiety are common triggers for occasional ED. But if it happens regularly, it may be a sign of an underlying health problem. ED symptoms include trouble getting an erection, difficulty keeping an erection during sex, and loss of interest in sex, spinal cord problem, and certain blood diseases. There is also a condition called premature ejaculation. Premature ejaculation happens when you release semen during sexual activity earlier than desired, usually after less than a minute of intercourse or masturbation. PE isn't necessarily a health problem, but it can interrupt sexual pleasure and cause relationship issue for some. I already mentioned cancer as well as an erectile problem, so let's now proceed to sexually transmitted diseases, one of which is very common called chlamydia. Chlamydia is a bacterial infection spread through unprotected genital or anal sex. It doesn't always cause symptoms at first, but over time, it can cause burning sensation when urinating, yellow or green discharge, testicular or abdominal pain, pain when you ejaculate, and fever. Aside from chlamydia, there is also a condition called gonorrhea. Gonorrhea is a bacterial infection caused by Neisseria gonorrhea, which is spread through unprotected genital, oral, or anal sex. Similar to chlamydia, gonorrhea doesn't always cause symptoms, but when it does, they include pain or burning sensation when urinating, frequent urination, redness or swelling at the tip of your penis, testicular pain, and swelling sore throat. Lastly, syphilis, which is a bacterial infection caused by Treponema pallidum. It doesn't always cause symptoms at first, but if untreated, it can become life-threatening. Syphilis has four stages, each with its own telltale symptoms. First is the primary syphilis, which is marked by a small, painless sore. Next is the secondary syphilis, which is marked by skin rashes, sore throat, headaches, fever, and joint aches. Next is latent syphilis, which doesn't cause any symptoms. And lastly, tertiary syphilis, which can cause loss of vision, hearing, or memory, as well as brain or spinal cord inflammation. In conclusion, apart from sperm and semen production, the male reproductive system also affects other external features through the production of hormones, particularly testosterone. Most men will maintain healthy levels of these hormones till they are quite old. However, certain conditions may affect your hormone levels. If you are experiencing issues with your reproductive organs, be sure to consult with a doctor or a urologist. Here are the references if you would like to further research the topic I've discussed. Thank you and have a nice day.